My name is Polly Pittman. I'm a professor at George Washington University's Mullan Institute School of Public Health, and I direct the Fitzhugh Mullan Institute for Health Workforce Equity. I'd like to welcome you to a webinar series on emergency health workforce policies to address the COVID-19 crisis. Recognizing the centrality of the health workforce to this situation, the purpose of the webinar is to identify policies that will help to protect and to strengthen the health workforce. The late Fitzhugh Mullan argued that the health workforce was an equity battleground. We are certainly seeing this today. Frontline workers are experiencing tremendous vulnerability, both in terms of their social and their physical situation, while at the same time trying to care for those most in need, regardless of where they live, the language they speak, or their insurance status. The risk that we're facing is that we will have a vicious cycle of staffing shortages. The surge in patient demand, combined with the insufficient protective gear, will lead to attrition. Some of that attrition will be due to family need, some to low morale, some to exposure, some to infection, and even death. The problem is that it will lead to further fatigue and low morale among those who remain, creating a downward spiral. The focus of the webinar is to identify actions that we can take now to prevent this vicious cycle. We are going to be covering 6 topics initially. The first is the federal 1135 waivers. The second is on telehealth policies that allow for additional distancing. The third is on emergency measures to expand scope of practice regulations for a variety of practitioners. We'll then be looking at expedited credentialing and licensure for health professionals, students, etc. We will be looking at protection and the rights of healthcare workers. And lastly, we'll be looking at task shifting, or what some have called repurposing of the staff within healthcare organizations. We look forward to receiving your comments and questions via our email, social media, and a blog that we'll be creating on our homepage. And we thank you for joining us.